Good morning, friends of the media. Welcome to the press briefing. The Chief Executive will say a few words and then she will take questions from the floor. Now I invite the Chief Executive to speak. Good morning, friends of the media, members of the public. Good morning. I have kept you waiting a bit longer this morning because I and my colleagues were reviewing the epidemic overseas from last night to this morning. And also we've reviewed the various measures announced by governments around the world. Now, in the past week, we have seen rapid spread of the COVID-19 in other places outside of our country, and the speed of spreading has been quick, and over 140 countries have been affected by the epidemic as announced by the WHO. And also in some countries, the speed in the increase in the number of confirmed cases could be described as explosive, and that's numbers continue to go up. And that's why on the 10th of March, WHO announced as a global pandemic. And as at yesterday, for number of confirmed cases outside of China, the minimum number is, because I could only mention the minimum, but the number keeps changing every day. It's been more than 82,000 cases with over 3,500 deaths. So these two figures are already higher than those on the mainland. And for Hong Kong, as at last night, counting also a probable case, that's 100. There we have 158 confirmed cases. This figure is much lower than that in many other countries. Is lower than that of at least 20 other countries and regions. But then with the continuous spread of the disease, the SAR government has now moved our focus from preventing import cases from mainland to import cases from overseas. Now, as I mentioned, we have, as at last night, 158 confirmed cases. When compared to a week ago of 116 confirmed cases, there is cause for concern. But then we can see for most of these cases, they are imported cases. Let's take the past 2 weeks. Now, there were 57 confirmed cases, 50 of them. That means 90% of the cases are imported cases. Either that, the patient concerned had a travel history during the incubation period, or these people are close contacts of imported cases of those with travel history. So we can say, therefore, close to 90% of the cases were imported from other parts of the world. If we take out the 50 cases, in 2 weeks we have only 7 locally infected cases. So as experts have said, that means we only have 1 or 2 cases every other 2 days. But unfortunately, because we have imported cases, so therefore our epidemic is now in relatively critical stage. If we don't take stringent measures now, then the efforts we've made in the past 2 months to prevent the spread of the disease would go to waste. So if we do not take proper measures, then these import cases may lead to community outbreak, and the consequence could be dire. It would, of course, also add to the burden of our healthcare system. Now, in any places, when public health measures are taken or when travel alerts are issued, there are always objective criteria and scientific evidence to support that. That's what we've been doing. And then so we shared with you the policies we have adopted in preventing the outbreak, and so far these measures remain effective. That we look at the number of cases overseas and the distribution of these cases overseas. And also, we have to see whether the increase in the number of cases is rapid or gradual, or maybe there's an explosion of cases and then things stabilize. Also, we also look at the measures of other governments taken to prevent outbreak. And then we also look at the frequency of Hong Kong residents visiting a certain place before we consider issuing a travel alert. And at the same time, of course, we have to consider the overall public health case and our healthcare system. We have to consider our capacity to cope, including the capacity of the healthcare system to cope. So in the past week, on 3 occasions, the SL government announced or issued red travel alert to against certain countries. And therefore, certain travelers from certain destinations, there will be quarantine measures at midnight last night, and also at midnight 2 days later. There will be such quarantine measures covering some 30 countries. But today, I would like to announce that given our latest assessment, very soon, probably today, for other countries and regions apart from the mainland Macau and Taiwan, for all other countries and regions, we will be issuing the red travel alert. In other words, Hong Kong residents should stop traveling unless it is absolutely essential. Otherwise, Hong Kong residents should avoid traveling either for business or pleasure. And then starting from the 19th of March, that is midnight of Thursday, the quarantine measures that will come into force will be extended to other countries and regions. In other words, the day after tomorrow, we will be implementing quarantine measures on Schengen regions, and also the United States and UK and Egypt. And now we're going to extend these quarantine measures to all other countries, regions. I would like to make an advance announcement here because there may be support measures that are required, and at the airport, certain measures have to be taken to avoid confusion. So, put simply, at 0 hours on the 19th of March, apart from people coming from the mainland Macau and Taiwan, all other travelers coming from other destinations have to be subject to mandatory quarantine and medical surveillance. This is to make sure that the achievements we've made from our efforts in the past 2 months won't go to waste. And that's supported by experts in Hong Kong. Actually, yesterday morning, I called the 7th expert advisory panel meeting, experts attending the meeting. Well, in particular, Professor Yuen Kwok Yung, who has already given his views openly. So with the support of the experts, we believe we ought to apply our mandatory quarantine measures and medical surveillance to all travelers from other parts of the world. And this measure applies to both Hong Kong residents and non-Hong Kong residents. For Hong Kong students studying in the UK and the US, now before we announced the quarantine measures because of the epidemic in those countries, or also the schools there have taken certain decisions, so many of the students have come back earlier before the end of the term to Hong Kong. So we have a large number of Hong Kong students coming back from the UK and the US. We care very much about them, and that's why we have suggested to the Cathay Pacific to operate more flights. And last Friday, I met with the senior management of the Cathay Pacific. So that's why, starting from this week, for flights coming from the UK, London, including Manchester, instead of 12 flights, there will be 21 flights. And then for flights coming back from different cities in the US, the number has been increased from 23 to 25. And then they're going to use larger planes to take more people, in particular Hong Kong students coming back to Hong Kong. The airliner told me that they will have regard to the needs of the residents of Hong Kong, and if they're able to assemble flight crews, then they will be operating more flights to take Hong Kong residents back to Hong Kong as soon as possible. And then for Hong Kong residents who are overseas and who are planning to come back to Hong Kong, we would like to remind them firstly to practice personal hygiene. Now, we know about the epidemic around the world, and we know how the effectiveness of social distancing measures, so they should bear it in mind. And secondly, when they are on a flight, they should wear a mask to minimize the risk of cross-infection. So that's why the SL government has already prepared 67,000 masks for free distribution by the airline to Hong Kong residents boarding in the UK and the US. Actually, we don't distinguish. We just provide the mask to passengers. But of course, we know that for Hong Kong students in the UK and US, they have difficulties buying masks locally. So if necessary, we will give more masks to the airlines to distribute this mask to Hong Kong residents. So when they are on the plane, they will wear a mask. The third reminder is please complete the health declaration form properly. Now, there is now an electronic health declaration form, so they could do it before they arrive at Hong Kong. And then they don't have to wait so long at the Hong Kong International Airport. Fourthly, there are places for which we have not yet applied the mandatory quarantine or medical surveillance measures, but we strongly appeal to Hong Kong residents coming back from these places to stay home for 14 days and wear a mask. This is for their own protection and the protection of their family members. But of course, if they have any symptoms or feel unwell, they must seek medical treatment as soon as possible. Now, we would like to arrange for more tests of the virus in a moment. Later on, Professor Sophia Chen will give you more information. Now, as I mentioned, I called the 7th Expert Advisory Panel meeting yesterday. All 4 experts were present. Professor Yuen Kok Yung, Professor Lee Chok Wei, Professor David Hui, and Professor Fujita. Now, as the WHO has already announced a global pandemic, so we reviewed whether Hong Kong needed to adjust its strategy. The experts believe that the strategy adopted by the SL government has been effective, and we should continue with it. And of course, it's also about preventing imported infection. Of course, 2 months ago, our focus was on the mainland. Now it's shifted to overseas. And then, secondly, we must try to reduce transmission within the territory. Now, on the first point, I already mentioned the further stringent measures we're going to take. On the second point about preventing local transmission, for most of the social distancing measures, they remain effective, so we must continue with them. That's very important. Now, 2 weeks ago, civil servants have already resumed work and resumed service. We are still taking stringent measures to maintain social distancing. As for school resumption, we will be very careful. Now, it seems that it is almost impossible for us to resume school classes on the 20th of April. Even if we could do it, probably it will be done by phases. Thirdly, the government will be hosting any large-scale activities where there will be a gathering of large crowds. So this is to maintain social distancing again. And fourthly, for every member of the public, please be patient. Please avoid meal gatherings or other social activities. Now, we want to maintain social distancing, but at the same time, we want to maintain normal activities. I fully appreciate, therefore, the importance of personal protective equipment such as masks and so on. Now, on government procurement and support for local production, well, there's been some progress. Our policy remains that we will first give priority to healthcare workers and all the frontline workers, carrying out prevention work. That includes carers of the elderly at homes for the elderly, and also the cleaners who've been helping to keep our city clean. So they will have priority to access the masks we have procured or produced. Now, there's been some small progress in global procurement with some resumption of production around the world. We are seeing that some certain masks are still able to get to Hong Kong. Of course, the quantity is not large enough yet. I hope there'll be improvement later. And then I said earlier that apart from central procurement, we also allow departments to buy masks on their own, and there's been some progress. I know they've been able to buy 2.6 million of masks. And then 2 days ago, I went to visit the CSI production line, and I see there are also local production lines starting production on research on reusable masks. I see there's been some progress too. Hopefully in April we're able to announce how we're going to distribute the reusable masks. So the government is taking a multi-pronged approach to provide sufficient personal protective equipment for everyone. But the tight supply probably will remain the case for quite a while. As you see, some exporting countries have stopped exporting personal protective supplies. So if there are people in the community who are able to buy masks, we welcome donation to the SAR government. All the donated masks will be passed on to the underprivileged and groups with needs. Now, through this mechanism, we've been able to pass on more than 3 million masks to the elderly, the underprivileged, and patients groups. And there are still 2 million masks being passed on to people with needs. The same multi-pronged approach applies to masks for children as well. I note that in the past few days, there's been concern that schools are about to resume. What will happen if we can't get masks for children, because there's an even tighter supply of masks for children. So I have already shared with you that we are taking a multi-pronged approach. The CSI will convert one of the semi-automatic production line for the production of masks for children. And then they will bring in new machinery or semi-processed, semi-finished products for further processing. We have actually bought a batch of children's masks, and we are prepared to share them with schools. As for local producers, if they join our subsidy scheme, we will require them to produce masks for children as well. The Education Bureau, of course, is the bureau in charge. It's been in contact with local producers to increase the production of children's masks. I mentioned the use of technology for developing reusable masks, and there'll be a children's version as well. So later on, this mask could be distributed as well. Professor Sophia Chan will tell you about what we need to pay attention to in keeping home hygiene and so on. But before that, I would like to sum up a few points, so hopefully everyone in Hong Kong would receive the message. First, this fight against the epidemic will be a drawn-out one, so please be prepared for that. It is difficult for us to deal with this epidemic in a short time. As our experts and the WHO have said, we have to slow the spread of the disease. So our scientists will have enough time to develop vaccines and so on. But as this is going to be a long battle, we cannot just let all activities come to a halt. That's why civil servants must resume service to the public. So we need to engage in productive work. Second message, we must try our very best to support our healthcare system. Hospitals in the hospital authority cannot collapse as a result, because that will affect the well-being of everyone in Hong Kong. So that's why we have to talk to the hospital authority about their capacity. third point, I believe some people may think that our quarantine centers or monitoring are not done properly and so on. Well, please do appreciate that. For every person we send to a quarantine center, there is a large amount of monitoring and support work that needs to be done. Now, from the point of sending someone to a quarantine center and then sending free meals a day and then medical support. Now, at the same time, there are over 2,000 people under home quarantine. Again, we have a large team supporting the home quarantine arrangement. So we need to reserve our capacity. For quarantine centers, they will be saved for high-risk groups. In other words, close contacts of infected cases. So for many people coming from overseas, as you can see now, our approach is mandatory home quarantine and medical surveillance. And then for the measures to work, all those put under quarantine, especially those under home quarantine, must be fully cooperative. They have to exercise self-discipline. Fifth, if we find that someone has breached the statutory requirement in terms of giving false information in the health declaration or during mandatory quarantine, the people leave their home, then we will take such cases seriously and will follow up definitely. Finally, we hope Hong Kong people will remain confident. Just as you pay attention to your personal and environmental hygiene, please go a step further so that together we could fight the epidemic together. Thank you very much. Professor Sylvia Chow will now say a few words.
Thank the Chief Executive for her remarks, and good morning, friends of the media. Today, I would like to talk about, well, just now the Chief Executive said that on the midnight of 19th of March, for the quarantine arrangements for those arrivals. First, some of them will undergo compulsory home quarantine or medical surveillance. Let me talk about the home quarantine first. So these are the points to take note. Three aspects. First, what will be the arrangements, and second, on the personal level, that they need to maintain good personal hygiene, and third, for the environment, they need to maintain their environmental hygiene. First, let's talk about the arrangements. Well, at home, they should try to arrange those under quarantine live in a well-ventilated and a single room, and also arrange the family members to live their respective rooms, and also keep a minimal distance of 1 meter apart, and should not share towels or personal items. And during meal times, they will need to use a communal cutlery, and should not share a lunchbox, and should not smoke. And you also need to maintain good personal hygiene. We stress that all the time. However, we should exercise restraint. For example, they should stop touching their nose and ears, and should frequently wash their hands. And after touching their nose and ears and nose, if that's unavoidable, or when dealing with food, or going to the bathroom, or if your hands are soiled, you have to wash right away. Or if you, after sneeze or coughing, if you're covered with your hands, you have to wash immediately. And well, it's best to wash your hands with soap. If not, you can use sanitizers. At least rub it for 20 seconds. And just as I said, when coughing and sneeze, you should cover your hand, nose, and mouth with tissues. And if you like to cough up the phlegm, you should cover it with a tissue, and it should be discarded in a covered rubbish bin. After using the bathroom, you should put down the cover before you flush. And third, on maintaining good environment hygiene. That's very important. We need to make sure that we're well ventilated at home, and at least once a week you need to clean your home using one to 99 diluted bleach, and for the surface and on the floor, if there's any dirty or with any vomit or sputum, you have to clean it with diluted bleach. And if you have any excretion or vomit or very dirty articles, I suggest that you use an even more concentrated bleach to the ratio of 1 to 49. As we spray all the time, you have to maintain your pipes and drains, and you need to inject half a liter of water onto the drains outlet. And on the handling of home rubbish is also important. So that's the home quarantines matters to take note, which cover that person in quarantine and the family members. And the chief executive we'd like to talk about the arrangements for the virus testing. And before the epidemic, we have been expanding the testing for the virus, so that as soon as we catch a confirmed case, we will take the containment strategy for early detection and isolation and early treatment, which they can be done at the hospital authority. If we can do testing as early as possible, we can cut off the chain of transmission, so that these potential carriers will not pass on to the other people. On this front, the Department of Health proactively to further expand the virus testing and to cover all the high-risk arrivals returning from overseas for the testing of the COVID-19. Now we have further expanded the scope. As you may remember, the first is hospital, now it covers all the general outpatient clinics, and which are all outpatient clinics in Hong Kong, and together with our A&E departments. Most recently, this testing has now expanded to all the invited private doctors and hospitals. Currently, the Department of Health is currently looking into the details on how do we perform testing for those arrivals to Hong Kong, especially for the high-risk groups. As you know, we're familiar with the overall procedure at the airport, and for the overall arrangements, it is very challenging. And second, our testing capability and how many tests can we carry out each day. Thus, we need to conduct a risk assessment in handling this. And thirdly, for the overall procedure, and how do we deliver the report after testing, and how should we handle for cases that are tested negative and positive. So these are all being arranged. We had come up with this e-posters as for points of reminders for those under home quarantine, as well as for their family members. May I suggest that those under home quarantine or those who will return to Hong Kong not to put under quarantine, they should download this e-posters and print them out and put it somewhere prominent at home, and constantly reminding yourself and your family members of what precautions to be taken. Thank you all.
OK，唔該晒咁多位。
Thank you.
而家係提問時間，請大
And
家
now we open for the questions. Please put your hand and speak through your microphone.
林太你好，Now 新聞台嘅。
Now News. Good morning, Chief Executive. Just now, you said this new arrangements would exclude mainland and Macau and Taiwan. When these measures against mainland is in place, why do you issue a red travel alert for them? And just now you mentioned, let me see.
頭先其實今次呢個做法係類似澳門
Well, this arrangement is similar to the Macau yesterday, and Macau yesterday would announce it today and implement tomorrow. But now you wanted to implement it 2 days later. Would that create a vacuum? We have a large group of overseas arrivals who wanted to crash the gates to avoid this quarantine arrangement. And I believe that the home quarantine maybe doubles, and you claim they will rigorously enforce this quarantine arrangements. So you can see that the only 2 were prosecuted. You have issued 290 warning letters. Is this measures really effective, and the government manpower able to cope with a potential doubling of the home quarantines? And let's say a resident found those going quarantine leave their home. Was that a reporting mechanism? Is it more effective to ensure that they do stay at home?
第一咧就有關於由保安局發出嘅紅色外遊
As for the
警示
red travel alert issued by the Security Bureau, and it usually applies to outside of China. So we just simply follow established practice. Thus, I announced today that those countries and regions outside of China, that we will issue a red travel alert. That doesn't mean that we're not been trying to prevent mainland imported cases. As you may recall, that 2 months ago, all this focus was on preventing import cases from mainland as well. We consolidated border control points from 14 to 3, and since the 8th of February, we come with a new regulation, CAP 599C regulations, which require that all the mainland arrivals, either through the land or by air, to undergo 14 days of compulsory quarantine. Well, we just simply bring the mainland arrangement to apply to overseas countries, but now the focus has now shifted from the mainland to across the world. So this is consistent. Of course, Hong Kong and Macau is different situations. It's difficult to make a difficult comparison. We are an aviation hub, and we have tens of thousands of students studying overseas. Well, usually we give a time around 24, 48 to 72 hours to allow you to make preparation. Also a pragmatic approach. Otherwise, it would lead to chaos. You can see some foreign airports get in chaos due to the abrupt entry bans. And we're talking about planes at the airports. Thus, you also have the flight frequency restrictions. And yesterday, those arriving at Hong Kong International Airport, we have 12,000 arrivals. Well, slightly less than 2 days ago, as I believe that the Cathay Pacific will respond to the demands from the US and UK, that number will rise. As we already announced that since Thursday midnight, to implement this to cover UK and US and other countries. So we not wait for 70 hours. Right at Thursday midnight, that all other countries were subject to this quarantine arrangement. I covered that in the cover remarks. However, I can offer more details. And each time we issue a home quarantine order in mandating a person to undergo this home quarantine, what you see is just a surface. And the operations behind this is enormous. For each confining, they have to go under smartphone or electronic wristband surveillance. We also arranged a medical consultation for them. Thus, the Center for Health Prevention have offer hotlines with a lot of operators to take their calls, which I visited, whether to calling them to check the condition or taking phone calls. And since they couldn't leave home within 14 days if they have no friends or relatives, we have some colleagues serving at the Home Affairs Department and the Social Welfare Department to support them. The Social Welfare Department on each day will need to support 800 families, delivering food and other aspects. We also conduct spot checks, so the disciplinary services need to conduct them. Well, altogether, we're talking about thousands of our colleagues working with us. And we have issued 60,000 home quarantine orders after 8th of February. As for the number of violations, it's rather small. However, we will pursue them rigorously. The Department of Justice will prosecute the 2 cases, and for the dozens or so cases, once we have enough sufficient evidence and collect the statement, we will conduct prosecutions on them. It's like I said, for any public health crisis, would require the public to fully cooperate to achieve this. If the public will not adopt the attitude of willing to protect Hong Kong and maintain our hard-won results of anti-epidemic efforts, no matter how much manpower we put in, we cannot guarantee that there will not be any loopholes. Thus, I wish all members of the public, whether those under home quarantine or their family members or their friends and relatives, and hope they can support this home quarantine effort and to provide all this necessary support to its home confinees.
That's always been the practice. Next, please.
A few English questions from TMHK English News. First question, several countries have taken the path of banning entry for everyone except residents. So why has the government not taken this move but instead chose the path of travel alerts or stepping up the quarantine requirements? Second question, everyone entering Hong Kong from first day will be quarantined for 14 days. Do we have enough quarantine center spaces looking forward? And while most of the people will be doing a home quarantine, does the government have enough manpower and resources to conduct checks and offer support, etc., as you mentioned, because it's a huge team of people supporting this whole quarantine arrangement? Third question, CE, you have mentioned that it's impossible to end the class suspension on April the 20th. Do you have the estimate of when class can really resume, and will it be possible that class can really restart till the end of this school term, that is July? Thank you.
Thank you very much for those 3 questions. First is about banning entry except Hong Kong residents. This is a very drastic step, which we did implement it very early in the day on the 27th of January as far as residents coming from Hubei and Wuhan. So as I said, throughout the process of this anti-epidemic work, we have to base our decisions on science, on the actual situation on the ground and other implications. And the important point is, if I can share this statistic with you, all the confirmed cases, especially those so-called imported cases, or those who have travel history during the incubation period, or the close contacts up till now, they are all Hong Kong residents. So with that sort of factual situation, I think it is a bit too drastic to go into that sort of total banning, because we have to understand that there are always some very genuine and compassionate cases on an exceptional basis that despite a 14-day quarantine, they need to come into Hong Kong. And Hong Kong, as I said, while we are still in the epidemic situation, we have to allow the city to continue, the business to resume. Otherwise, we may have more problems on the economic front. Now, the second point is a very valid one, which I have explained at some length. We will be seeing more people who require compulsory quarantine or medical surveillance. So I have said that we have very limited quarantine center. Basically, now is about maybe 1,600, including three blocks in Zhunyang estate. Okay. So with this very limited quarantine center facilities, we have taken the view that they should be reserved for really the high-risk cases. So who are the high-risk cases? One is the close contacts of confirmed cases. And you don't know, I don't have a crystal ball. Sometimes one confirmed case could give rise to 100 of closed cases. So we have to reserve that capacity for the high-risk cases. Secondly, is from time to time, we have unforeseen incidents, like this Daibo Fuhangxuan Hangtai Lao. It's an unforeseeable incident that suddenly we need to evacuate and put them into quarantine center because they're also high-risk cases. So from now on, most of, I would say, the majority of arrivals in Hong Kong will be put under home quarantine or medical surveillance of some form. So your question then is how can we assure that there will be good compliance for the home quarantine cases? We will do our best in terms of the monitoring, the surveillance, the telephone calls, the WhatsApp location services, and spot checks. But at the end of the day, because of the large numbers involved, right now we already have over 20,000 active home quarantine cases. We are expecting more. So I'm appealing to individuals who are being put under home quarantine to have self-discipline, to observe the rules and the requirements, and to protect themselves and their family members, and ultimately, of course, protect Hong Kong from a major outbreak. Since we have been doing quite well in the last 2 months, we really should preserve this results that we have made through joint efforts. But we will increase our staffing at various levels. I have asked for more civil servants to be sort of enlisted to join this anti-epidemic work, both at the airport and in the various back offices to support the home quarantine work. Now, class resumption is a very tricky matter because we're talking about 900,000 students, especially those in primary schools and kindergartens. So at the moment, I could not say categorically, but what I can say with a bit of assurance and support from the experts is, they said as the chief executive, you don't expect to be able to resume all schools in the next month or so. It would not be possible because of the global situation that we have seen, and especially because this virus is a bit tricky. There's a lot of pre-symptomatic and asymptomatic cases in society. So I'm saying that even if the situation stabilizes to the extent that we could resume, it will be by phases. We'll be starting with the older students in the senior secondary, and so the chances for the very young kids to go back to school, say within the next 1 to 2 months, will be quite slim. But having said that, I am still gearing up the production and supply of children's masks so that when the day comes, we will not be facing another problem that we could not resume because we don't have the mask supply for the kids to wear. So we will keep you informed. In fact, I understand even today, apart from the 4:30 regular press conference, we may have another briefing by our CHP to talk about other subjects because things are changing very rapidly. 好嘛，多謝晒大家啦，唔該嚇。
Thank you very much.